The most extraordinary one I ever saw was there was a doula, there was the mummy, and there was the daddy of the baby, and it was labour, and they sung on different levels. The doula was the high pitch, the mummy was the, and the daddy was the, and oh my gosh, people were saying, Jenny, are you okay? And it was the most crazy thing. But my God, it worked because everything was vibrating in the bottom of the tummy.
Welcome back to part 2 of the Eat, Burn, Sleep podcast. We are now jumping straight into the second part of this episode. If you haven't had a chance to listen to part 1, I invite you to go back and listen to it now. Let's continue the conversation and pick up right where we left off. And there is something else I want to talk about, which is the perception of pain. So the first birth, because I didn't feel in control, I felt a lot of pain. The second birth, although it was painful, my body was releasing the right hormones. So I was listening, and you listened to me, and you allowed me to have my iPod. At that time, it wasn't AirPods. I had the wire, and I was listening to mantras, to this album from Deva Premal called The Essence.
That is what I always say to my women.
And maybe you did tell me.
The Guarani mantra.
Yes.
Oh.
So I listened to the mantras for the whole time. And what would happen is my body was pumping the anti-pain hormones.
Endorphins.
The endorphins. And I was falling asleep between contractions. So the doula took photos, and there are pictures of me with a thing, falling asleep between 2 contractions. Then the contraction comes, and then I'm dozing back, and then I'm coming back. So after the birth, I have not needed a single painkiller because my body was producing the painkillers.
Yes.
And that was extraordinary.
I think it's so interesting. The more, you sort of think of some of these, great alternative obstetricians, and of course, amazing Ina May Gaskin from America with the farm and all the women that came to her for birth, with all her amazing, Gaskin maneuver and all these amazing things. But also, too, the obstetricians, there's a book by Le Boyer, The Art of Breathing. And you look at this book and think, what is this book telling us? And there's loads of pictures with a lady kneeling, and it's about the breath, and it's about the positioning. And I think there's so much power in that, because if you do, for example, 4-8 breathing, in for 4 and out for 8, it's all in the bottom of the tummy on the out breath. And then you relax your head, your face, your shoulders, your chest, your back, your hips, your legs to your toes. And then if you imagine sort of a lovely colour going over your head, it could be pink or orange or purple, and then just go down and slowly just imagine it coming round, and you can hold your baby. Think of your baby in the womb swimming around, and then slowly go to the bottom of your toes, and complete body relaxation and breathing and visualising your baby. So powerful. And the mantras come into that. The way of the thinking, the rehearsal of this calmness, and that reduces the stress and anxiety. Interesting, if you I had a lady rushing in one day, and there's loads of ladies, I still do 12-hour shifts, so I don't know all the ladies in that much depth, but she came rushing in, I'm so stressed about my baby, I'm so stressed about him. I said, it's okay, let me take you in. And usually in this situation, I just say, look, pop your shoes off, pop on the bed, let's listen to baby. And by this time, her pulse is, about 99, and the baby's heart rate's about 158 or something. And then I do this little visualization with them. Just close your eyes and your body relaxation and think of your baby. And you see literally the pulse of the mummy and the heart rate of the baby both coming.
Amazing.
As she calms. And these little very quick techniques, but well practiced. And you can sit on the tube and know there's 13 stops or something. And I can just sit like this, knowing the stops, and be completely in a bubble. And it's sort of opening your eyes, closing your eyes, being somewhere else, still very open to everything that's happening, but in your little bubble. And that Girani mantra and, these things, whatever that lady was listening to with her earpods that day, take it down, take it down. And probably the most extraordinary one I ever saw was there was a doula, there was the mummy, and there was the daddy of the baby. Obviously, this is the first pregnancy. And it was labour. And they sung on different levels. So the doula was a high pitch. Ooh. The mummy was the ooh, and the daddy was a ooh. And oh my gosh, this was going up. People were saying, Jenny, are you okay? And it was the most crazy thing. But my God, it worked because everything was vibrating in the bottom of the tummy. And if you think of a contraction, it comes up. This part, this is a contraction. This third is okay. It's brewing, it's coming. This top triangle is quite... And I remember even with my children, I used to think if it gets any worse, I'm going to scream. But it never did. Because as soon as you get to the top, it comes down. And the last third is easy. So if you can get through the top triangle, it's there. And then you've got rest and be thankful, face cloth, water, relax, wait for the next one, up, down.
And it's
up,
only 30
down.
seconds.
And it's only 30 seconds.
Because the whole contraction is 1 minute.
Yes.
But the top, the apex, is only 30 seconds. And the rise in the apex is only 15 seconds.
Yes.
So you get the relief down. That's what I was thinking.
Yeah.
I was like, just hold on. It's only 15 seconds. And I was counting.
Yeah.
And it goes. But what? So you've helped women who have gone through C-sections birth naturally.
Yes. So for some women, they feel that they want a rite of passage to try to have a vaginal birth the next time. This can be for so many reasons. I mean, if you've had a previous cesarean, the situation is that you have a scar in the womb and there is a slight increase that the scar might open in labour. So the recommendations by the NICE guidance, our national guidance, is to have labours near the operating theatre and to monitor them carefully and listen to the mother if she's got pain over the scar or have bleeding. So you need to be generally recommendations. Of course, people do have home births with this. This is not necessarily what we would recommend, but there is that situation as well. So most women will be in a hospital, and they have actually a pretty high chance with a head-down baby that, 60 plus, maybe even up to 70% chance that they might be able to have a vaginal birth. Now, interesting, if you have a vaginal birth, the second time, so to speak, the chances of you having another vaginal birth then are much increased. In sort of high 80s, maybe 90% chance because you've had a vaginal birth before. So those ladies who perhaps want a big family, people like myself have had 4 children. So if I'd had a cesarean first, I probably might have wanted to have a vaginal birth the second time if I went on and had other babies. So I'm not saying that some people have had 4 cesareans and they're perfectly fine. But it's that you need to go into the mother. Would you like a VBAC? What are your reasons? Being certain that they realise, just like everything in birth, the information, the pros and cons of having a VBAC, what's my chance of having a vaginal birth, what's my chance of having an emergency cesarean, how will that work, and all this information. But yes, a lot of women have very successfully given birth to a vaginal birth after cesarean a second time round. And actually, interesting, I did have a lady many years ago who said to me, and this is a bit of an interesting one. She said, the reason I had a cesarean is because my obstetrician couldn't be waiting for a normal birth. And I went along with it. And I'm sure that obstetrician would have made arrangements for somebody else to wait for the birth. But anyway, so I just thought, well, he might not be there, so I better have a cesarean. And actually, she said after that, when I thought about that a long time, it was my decision to do that. But I made the wrong decision, I think, now on reflection. And I'm now going to want to have a normal birth. And she did. And so women's choices and perceptions change in time, and it's not for us to decide things. We're there to keep mother and baby safe. That's the remit of all of us, and for the mothers and fathers and families. Keep the mother of my baby safe, keep my baby safe, is what we're all aiming for. So the aim is the same. But around that, as I say, talk about the tributaries of rivers, things move and shake. And as midwives, we need to move and shake along the river as well to make sure that we're saying, is the pathway of how the mother's planning, can that change? For example, I had a lady with a low-lying placenta early on that went later to have a home birth, because there was no reason not to. But at the earlier time, it wouldn't look that would be a good idea at all, because she might bleed, but the placenta all slipped up. And in the end, there was no placenta there, and she had her home birth. So there's so many, it's just like every time you see someone, it goes along, little steps, go with the flow, go with the flow. If something isn't quite right, get it checked out, get an obstetrician involved, go with the flow, go with the flow. But always be prepared for something like your birth with your second son. It can change. And you must be like the Boy Scouts and have things right there ready and know who to call. But then that's a wonderful safety net around us all when we're there, because we're expecting something very normal, and sometimes very normal becomes, a hemorrhage or something. So we're ready. We've got our kit ready. We've got our bells and hospitals ready, and we call for some support and help. So it's almost like, I love the one-to-one, that huge connection, undisturbed connection like Michel Odent talks about. But I also love when we deviate. It's almost like the dance of the orchestra coming in, and we're all there keeping mum and baby safe.
Absolutely. So the way you talk about birth is the way I talk about health all the time.
Oh.
You want to do things as naturally, as holistically as possible, but you never want to be overzealous. Because if you become zealous, you go into a danger zone.
Yes, that's very true.
So I wanted to give birth naturally and in water, but in a hospital setting, because I knew complications were possible. So when I have clients come to me and they say, this is my condition, shall I do your program or take the medication? I always say, if you're that far, you need the medication to come back, follow your doctor's advice.
Yes.
And implement an anti-inflammatory lifestyle so you can get off the meds.
Yes.
So it's about using all the support you can have, nutrition, doctors, acupuncturists, osteopaths, you name it, for the best health outcome possible. And it's the same thing with birth.
So the same. And I remember when I wrote the book, and wonderful Michel Odent wrote a little passage in it for me.
So your book is Your Body, Your Baby, Your Birth.
Yes.
So tell us a little bit more about the book. So it's women-led. How did you come to write the book? And tell us about what Michel Odent wrote in it as well.
So he was the most amazing man. I went to many of his lectures. And he just wrote, you need a book that's back to basics, that's not in this digital world where women can get so off tangent. So he, it was to the effect, I wish I'd brought it, but it was just sort of look at things simply and listen to someone that knows what it is like in a professional context, as opposed to going into Google for everything, and getting lost in that way. But the book was a very special journey for me, because when I used to see the women, and we had so much fun, all of them, and so many women I'm still in touch with, and I'd scribble all my pen all over the notes at the back is like aid memoir notes. And then the lady said to me, no, we need the book now. Don't just put it in all. So that's how that came about, which was incredibly special.
It was all your notes published?
It was notes, yes.
Amazing.
And it was just their choices, their birth plans, their ways. But I put the themes in, have you thought about this? Have you thought about that? And the key thing was, like we've talked about, everyone is unique. They need kindness, they need support, they need empathy, they need love from in a professional context. They need to be heard, they need to be listened. Women lead us and we should follow. It's not the other way around. And obviously there was bits of physiology, and I think so much physiology is vital to have an understanding of that. And the alternative therapists, how much they're giving the yoga people, the creative healers. There's so many alternative therapists that have provided so much of what I acknowledge them in the book, actually, on the outside of the NHS. And I do think that we need to get more of that coming in. We do have a little bit of aromatherapy coming in now, but I think we need to bring more into the mainframe in the future for that as well. I've had such an amazing journey that you could never predict. But in the early 2000s, what was so wonderful was Professor Fisk and Felicity Platt. Professor Fisk was an obstetrician, very eminent obstetrician, and Felicity Platt, eminent anaesthetist, and myself decided to improve the birth experience for mothers having a cesarean section. And we really started this in 2000. I think we published the paper in 2006 in the British Journal of Obs and Gynae. And what we wanted to do was emulate a normal birth at cesarean. And we called it the natural cesarean, a woman-centred technique. Oh my gosh, there were many critics. We didn't get the paper through on some journals, and eventually the British Journal of Obs and Gynae took it. And really, it was very simple what we wanted to do. We wanted the mother to see her baby at the time of the birth, the mother to have delayed cord clamping, and the mother and the partner to have the baby skin to skin in the operating theatre directly after the birth. So we planned at the beginning for women with head-down babies, with everything else was normal. At no time did any infection control. Every safety mechanism within the theatre had to be done as theatre work has to be done. So there was no stopping any of that. But at the time of the birth, we prepared the mother first about would she like this natural cesarean. And we then obviously spoke with the team, because at the time don't just put something in, what's she doing? Mothers' heads coming up and looking at things. And, this was unknown at that time. So at the beginning, they have a gown without the sleeve. So it's just across here. And we put the pulse oximeter on the toe. And we put the cardiac monitors from the mother to the sides. And then we put the drip in the non-dominant arm so she could hold her baby properly. And we then sort of prepared the operating theatre. She could bring some music. She could bring her own pillow. Occasionally they had their own tops, actually. And then the operation started with the team all surrounding with all their different jobs to do. And then as the surgeon had made the incision for the little one to come out, just as the little head came out, we sat Mummy, who was down here, we sat Mummy up and we put the screen down for her Mummy to see the birth of her baby.
Fantastic.
So little head.
Oh my God, amazing.
And the womb was pushing down and the baby, through a process of wriggling and the womb pushing down, and little baby would come up, and the parents, some didn't know the sex, they'd say, oh, I've got a little girl, little boy. And then we did the delayed cord clamping, so the pulsing of the cord. The baby went straight up to Mummy and had a little hat, little covering here. We obviously dry the baby and keep baby right on the chest. Now, this is remarkable for the breastfeeding, because you've got skin to skin. The mummy's heartbeat slows the cortisol down in babies. Babies smell their mummies. They feel cocooned in the heartbeat. And the respirations go down to a normal level. Their heart rate goes down to another level. And they're on the womb on the outside. And this then promotes the breastfeeding, rather than the baby going somewhere all wrapped up, not in the mother. And in fact, years ago now, there was an obstetrician and she had a cesarean, and she said to me, Jenny, the baby's breastfeeding on the operating table.
Amazing.
And it was. I was just like, I can't believe that. And once or twice I've seen that now. It's quite difficult because there's a small space, but that baby was almost sort of dangling upside down, but feeding away. So this became a lot of critiques about this, 3 or 4 PhDs written on how we're trying to, reimagine what a birth should be like, and we're making a very surgical procedure, a natural procedure. You can imagine it was quite tough going. But after some time now, we know there's benefits with delayed cord clamping, more iron getting into the baby, more stem cells getting into the baby. And this extra surge of, say, 30 mils of blood makes the lungs expand better. All that helps the baby to become a breathing little person. And so there's benefits there. I do also think there's benefits with the placenta delivery, because there's time for the placenta to separate, rather than the doctor moving with the hand to get the baby, the placenta off the wall. So I think there's a lot more in this moving forwards, but particularly, as I've seen so many times, the psychological benefit for the mother. I saw my baby, I've got my baby, and it was the most amazing project that really has gone global. And I think we'll see a lot more research in this going forwards, but there's no detriment to this procedure. And we always have all present, if the baby came out and looked blue and thought, we just speed everything up, get baby in the right place. But if everything is fine, heart rate's fine before the delivery of the baby, and everything else, mummies get their babies straight away.
I would add another benefit as a nutritionist who's specialized in gut health and microbiome and immunity, is that if you put the baby on the skin versus being away, he's getting the holobiome from the mom. He's getting the
Yes.
the microbiome of the mom. So we have, in our insides, we carry around 2 kilos of bacteria in our tummies, but all over our skin, in our breath,
Yes.
we're all bacteria. So the baby being on the mother immediately means that the first thing that's populating his skin and his gastrointestinal tract is the mother's bacteria.
Of course, absolutely.
So that is crucial, and if with better gut health means better immune system health.
Yes. And often with mummies as well, I say to them to have the muslins and sleep with them. So the cloths have been the smell of the mummy as well with the microbiome. So, gosh, yes. I mean, it's so huge, the skin to skin and the breastfeeding for the babies afterwards. But of course, I have to say, there are some mummies for many different reasons who may not breastfeed. But with these mummies, I always say, still do the skin to skin.
Yeah.
Still feel the baby in the bubble. And formula feeding for these mummies is the next best thing. If you put them skin to skin and hold them tight, because that is the parenting going forwards. And just like you said earlier, we are all very different, and we've all had very different spheres of life. And the most important thing is that family pod of you all, and the calmness and the beauty. And, you know, indeed, I've had mothers who have had breast cancer that don't have the breasts anymore.
Yeah.
And so there isn't that choice. So you look at how can we move around these choices to keep, you know, the word of the bonding. Because this 0 to 2 years is so important for children.
So important. And so for mothers, for example, who can't breastfeed, and for all mothers, sorting out your own diet is the best thing you can do for your baby. First thing is it improves your fertility.
Yes.
Whatever you're feeding yourself obviously feeds the baby. But after birth, the bugs you're giving your child are better ones.
Yes.
So through the skin, through breath, and also fathers.
Yes.
So we've shown that actually a lot of health is shared within a household because the bacteria is shared, even between partners. But that's a whole other podcast that we can record. So for parents to be sorting out your diet is the best thing you can do for your baby, even if you cannot breastfeed, because you're still sharing the bacteria in that way.
Yes, gosh. And all the placental transfer of all your, you know, your immunity and all from, it's amazing.
Jenny, it's been such a pleasure having you with us.
It's been so wonderful.
I'm going to add your book, Michel Odent's book, all the books we've mentioned in the Yalda Love section of my website on eatburnsleep.com, so everyone can go click there and read them. Your knowledge is so crucial. You're a wealth of knowledge. You have so much experience. And what I'm hearing from what you're saying is there are different ways of giving birth. There are different scenarios. There are complications, less complications, sometimes less complications than expected, and vice versa. But that the woman, her feeling is often right.
Yes.
That
always
is
listen to the mother.
That's the takeaway.
Always. Visceral approach. And to keep calm as a professional, for them to be calm and to listen to the answers they give you, because the answers are what they're trying to tell you, even if it's not exactly clear.
The information is there.
The information is there.
You're a very good listener. You've spent your life listening.
Yeah. Oh, I love the woman. I love midwifery so much.
Jenny, if people want to contact you, where can they do that? They want to get in touch with you.
Yes. So they could get in touch probably through the Instagram's the best thing.
Okay.
Yeah.
We're going to tag you on all of that so they will be able to do so. Thank you so much for joining us today. It's been an absolute pleasure.
Oh, Yalda, so the best and so lovely all these years ago with your gorgeous son. And we're here today. And wow, what a journey.
Thank you.
Thank you.
Thank you so much to all of you for listening to this podcast today. I hope you enjoyed it. It's always such a pleasure to talk about health because it's not about the destination, it's about the journey. Looking after our health is a daily thing, just like brushing our teeth. We've got to focus on it, we've got to do it right so we can live better and happier lives. For those of you who are not members of the platform yet, we have a discount code for all our podcast listeners. You can get 15% off the memberships. Just enter the code podcast15 at checkout. And make sure to read all the articles and all the free content we have on eatbrandsleep.com to keep you motivated and informed and educated about living an anti-inflammatory lifestyle.